We are already, as you see, engaged in a riveting discussion with my next guest, Moses Gama. We are talking about youth-related matters, and some young people are supportive of the proposed national liquor policy, but they doubt whether or not it will be effective in their communities. Well, the Department of Trade and Industry has started a consultative process for suggestions and comments on the document. Among other changes, it wants to increase the current legal drinking age from 18 to 21. Well, to discuss this and other issues, we are now joined by Moses Gama, the founder and director of the Tsohang Youth Project. A very good morning to you, and thank you so much for joining us.
No, good morning. Thanks so much for this opportunity.
And I believe congratulations are in order. You have this beautiful trophy with you today. This award, the MEC Mazibuko 2015 Special Award in recognition of your positive contribution towards the fight against substance abuse in Gauteng province.
No, thanks very much
for
this opportunity. Warm greetings to the viewers at home. Yes, it's a collective work. It might have been given to me as Moses Gama, but it's a collective work of the community which I'm coming from, the Tsohang, the Gauteng area, and Tsohang Youth Project, executive management, and all the stakeholders which we are working with, and the service users as well, because they are responding positive when we are going out there and raising awareness. As much we are not yet in harm reduction organization, but as a demand organization, we are able to link them and refer them to some of the treatment centers so that they can be able to access help. But yes, we acknowledge the fact that within Gauteng, we are having about 2 public treatment centers and other subsidized and NPOs. But because of that, we have said we need to come with a campaign called One Kasi, One Treatment Center campaign, which calls for treatment centers within our surroundings, especially when you are saying One Kasi, you are not literally meaning each and every section, but we are saying as per National Drug Master Plan and Prevention for and Treatment of Substance Abuse Act 7th of 2008 is calling for community-based initiative as we are there. So we are saying as to how we need to make sure that the private sector authorities and individuals within the communities, they need to come on board as well so that we assist, because our brothers and sisters, they need help with regard to issues of accessing treatment center, because we can be talking, raising awareness and preventing, but if they're not accessing treatment, then it becomes a challenge. So we've taken upon ourselves as young people of Tsohang Youth Project in the community to say, let us make this call, because it's an urgent call where we need everyone, so that, because it's not a responsibility of only the government, but it's our collective and responsibility to make sure that our people, they access that treatment center, because on the ground, lives are ruined. And
there is a need. There is such a demand. Indeed. Substance abuse in South Africa is quite problematic, and you and I have said it leads to a number of other social ills, because when you're under the influence, it's easier to have sex perhaps without protection. It's easier to be engaged in acts of violence, domestic abuse, you name it. So it can be something that leads to other social ills as well. Why did you decide to stand up and make a difference personally? Why was it your decision?
Yeah. Personally, I'm a beneficiary of the lives which were lost. People, they went to exile, to sacrifice. Others, they don't know their brothers and sisters. So we cannot take a back seat while lives of our brothers and sisters, especially young people, are ruined. So I've seen, I'm not hearing statistics, I've seen young people who are immensely talented, their lives being ruined by drugs and alcohol. I've seen some of my schoolmates, they are incarcerated. Some of them, others, they've lost their lives. So I felt that I need to mobilize and bring other young people so that collectively we can reach out to our people. Yes, we might not have been on harm reduction and supply reduction, but we can play our beat in making sure that we are reaching out to them so that they know where to go, how to go about it, what are the consequences. As you alluded earlier on, when you check, some of these young people, they are no longer going to school. Some of these are dropping out of tertiary university, of which these are the same people who are supposed to contribute to our country economically and otherwise, but they couldn't because they are using drugs and alcohol. You go to correctional centers, the young people there who are incarcerated for committing heinous crime, most of them is because of drugs and alcohol. And when you check some of those young, they are serving long-term sentences, while others are young, of which those are young people who are supposed to contribute towards bettering our country
and our communities. You know, one school of thought says, I'm allowed to vote at the age of 18, and yet you're telling me that if these new draft laws come to pass, that I won't be allowed to drink until I'm 21. How can I be allowed to vote at 18 and only allowed to drink at 21 if this comes to pass? Like I said, is there a discrepancy there? What do you make of this adjustment in the drinking age, or proposed, I should say?
Yes.
It hasn't gone through yet.
I think it shows that we are having a caring government. As much as we might not agree with that, but in some of the countries, this has worked. And this is a collective effort, because the government has consulted with the people on the ground. Because during the second biannual substance abuse summit, which was coordinated by CDA and the department, the delegates, they all come, of which the Honorable President was there in terms of addressing the delegates as a keynote speaker. They took that decision because of what we are seeing. We are on the ground, as I'm saying, I'm from Katlehong. And then when we see young people being accessing liquor and so forth, yes, we understand that some of these adults might buy for them, but we need to make sure that there is laws, and as well, we must make sure that the law enforcers, because we might have that and say increased age, but if you are not doing enough in terms of reaching out, education, awareness.
I want to jump right in there, because you said something that's absolutely critical to this discussion, that the legislation at the moment says 18 is the legal drinking age, and yet we're still seeing, like you said, underage children under the influence of alcohol. So it's not the legislation that seems problematic, it's the implementation thereof. The law enforcement, the making sure that there are ways to enforce that law in the taverns, in the bars, in the clubs, in the shebeens, you name it. What difference will adjusting the age limit do if we're already having problems with the enforcement of the current age limit of 18?
Yes. I'm happy because the same liquor draft proposal is calling for a government fund of which, because now the industry is regulating itself, and so of which they're supposed to assist in terms of making sure that they empower NPOs, they empower community, so that they can be able to educate our people and reach out to our people. I think based on the proposal that has been made, at least that 1% or 2% will assist in making sure that the community and law enforcers are strengthened, so that they are able to reach out and enforce this law. So I think in that regard will go a long way, because you know, as 21, at least that person is in a position to take informed decision. And in some of the countries like United States and others, this has helped, and as well always there will be gaps in terms of unregistered and organization or institution coming on board as well. But those are kind of challenges that will always be there in terms of those gaps. But I'm happy because that fund will assist as well, and then it says that body will be able to distribute that money in terms of the NPOs and NGOs, because the ARA is not coming on board because it's the industry regulating itself. So hence they are not doing enough in terms of reaching out to our people, other than just having advertising themselves, putting the labels and so forth. So we need to reach out and give this process a chance, because lives, the reality is that lives is ruined, and lives of our South African young people it's ruined. So government is saying, and the community, let's do something about this. It will always, of course, be challenged, but we need active citizens
to try and mitigate those challenges. Moses, I think there's no doubt that this is quite a huge problem, and one that needs to be dealt with as a matter of urgency. I think where people would differ is how to deal with it. We'll have to leave it there, I'm afraid. Moses Gama, founder and director of the Tsohang Youth Project, is speaking to us on a range of issues which perhaps we'll have to revisit at a later stage. Issues such as accessibility. Why is alcohol and substance abuse so prevalent in various areas of the country? Why are we leaning towards numbing our emotions in that effect? Perhaps that's a discussion for another time. Quick ad break. Morning Live continues after this. Stay with us.